For 5 minutes.
Thank you, Mr. Chairman. Prior to the enactment of Medicare in 1965, 56% of older Americans could not get coverage because they had the pre-existing condition of old age. That's when the Medicare program was established. Today, 97% of older Americans have access to good quality health care through the Medicare program. Pre-existing conditions is basically good people that are treated differently by private insurance because they were born with a genetic mutation that causes or increases the risk of disease. Those diseases include childhood cancer, juvenile diabetes, kids born with Down syndrome, cystic fibrosis. Before the Affordable Care Act, almost 50% of adults between the ages of 50 and 64 and a half tried to buy health insurance for them and their families, and they were denied because of pre-existing conditions. You can't do that anymore. It's against the law because of the Affordable Care Act. My colleagues on the other side keep saying that everybody up here supports pre-existing condition protections. That's not true. Everybody up here does not support pre-existing condition protections. House Republicans between March of 2010 and July of 2017, more than 7 years, House Republicans voted 70 times to repeal and replace the Affordable Care Act's pre-existing conditions protections. Everybody up here does not support people with pre-existing conditions. Having failed 70 times, Republicans then advanced their new plan. The insidious, malicious language in there said that you had a health insurance company had to write a policy for somebody with pre-existing conditions. But that policy didn't have to cover the treatment of a family member, a kid who's stuck with childhood cancer for that pre-existing condition. So no, everybody up here does not support protecting people with pre-existing conditions.
Will the gentleman yield?
I will not yield. I will not yield. I will not yield. I will not yield.
Back.
So House Republicans couldn't pass legislation to repeal and replace. They couldn't pass their own health care plan because nobody supported it, because nobody believed them. So then they went to the states and they said they'll do what we were unable to do. 20 states' attorneys general joined a lawsuit challenging the Affordable Care Act and the pre-existing conditions protections in federal court. 11 of those states have the highest population of pre-existing conditions. So the only hope left is the White House and the White House's Justice Department, who could come in and save the day. They filed an opinion saying that they would not defend the Affordable Care Act and that they opposed and characterized as unconstitutional the pre-existing conditions, protections of the Affordable Care Act. Nobody up here, not one person up here, supports pre-existing protection for the American people. Not one person up here, and not one Republican out there either. You go ask the state's attorneys general in those states that have joined together to fight this protection that people fundamentally need. Here's the bottom line. The Medicare program did what private insurance companies had the opportunity to do and decided not to, because they don't make a lot of money on people who are sick. That's not who we are as a nation. That's why we should allow people to use the leverage of the Medicare program to buy in at their own expense so that they can get the protection of pre-existing conditions now. The private sector has had all kinds of opportunity. And the great irony in all of this is that Medicare was established as a public program. And guess what? When it was so successful, guess who wanted to get involved? private insurance, through Medicare Advantage. Look, I think the choices are pretty clear here, and I think that we will have legislation that will affirm in clear and unambiguous language.
Mr. Chairman, regular.
We are
order.
going
Let's
to
stay on the
support
time that we have for the
Thank you,
members.
gentlemen. His time has expired.
who have pre-existing conditions. I yield back.
Thank you.